Welcome to the MedMonitor Demo. MedMonitor is a proprietary software application to support the delivery of patient-centered care. The software analyzes prescription data to identify potential and actual drug therapy problems, which we call alerts. These issues are then displayed on a user interface for clinicians like doctors or pharmacists to assess the patient and document decisions and interventions in a standardized and evidence-based manner. This demo of the user interface is populated with de-identified patient data. When a user logs into the platform, the user is directed to the dashboard which displays important metrics related to their pharmacy or program. Clients can also make requests to our team for additional widgets to show other metrics of interest. Next, the Patient tab displays a list of patients with alerts. In addition to basic demographic information, a patient's highest alert level, the number of incomplete alerts, and the number of completed alerts help sort patient by urgency, complexity, and severity. There is also a search bar to pull up a specific patient profile. Click the patient ID to open the profile of interest. Demographics information and medication history come from data sources like pharmacy dispensing software or third-party adjudicators' drug claims history. If available, MedMonitor can also pull in disease and allergy data to increase alert sensitivity and specificity. The next section is SOAP notes and contact history from past patient interactions. SOAP notes are clinical documentation, whereas contact history displays call histories such as outreach attempts or incoming calls. This section is blank if a patient has not interacted with a user using MedMonitor before. Following this is the patient's medication history. It is refreshed daily based on the previous day's prescription activity. Users can hover over each medication name for more details on the product. A medication's direction of use and clinical purpose can be revised to best reflect patient's actual use behavior versus prescribed instruction. Next is the alerts section, where we can see this patient has triggered 4 alerts, indicating 4 potential drug therapy problems. The user would ideally consult with the patient to confirm each alert's validity, then what, if any, steps are taken to resolve the issue. For any drug therapy problem where a product is recommended for addition, the recommendation field will be populated with a drug that's clinically validated by our clinical team and compatible with the patient's current regimen. An FYI is shown for any DTP where no addition is needed. The recommendation field is editable to suggest an alternative product. MedMonitor identifies a therapeutic duplication with this patient's fluvoxamine and duloxetine. These are both antidepressants that typically are not used together. After investigating, you recommend the patient stop one of the 2 drugs, so you select yes to indicate a validated drug therapy problem and the intervention needed to fax the prescriber. This decision and intervention are automatically generated into the SOAP notes above. The patient is also using a maintenance inhaler for COPD but does not have any fill for a rescue inhaler. After discussion and agreement that the patient would benefit from a rescue inhaler, select yes to send a fax for a prescription. For drug therapy problems where the user has determined not to be a valid issue or an issue anymore, use the drop-down list to select the appropriate rationale, which is populated into the SOAP notes as documentation again. MedMonitor also has a date picker to schedule follow-ups with the patient. Upcoming and missed follow-ups are listed in the Follow-up tab in the patient's page. The last sections are for prescriber and patient communications. In this scenario, I need to inform the doctor about the drug therapy problems discussed with the patient as well as the actions required by the doctor to resolve the issues. 1 or more alerts can be included in a single document directed to the same recipient. Once all alerts are selected, a content box for each will appear. Verbiage will automatically populate describing the drug therapy problem and action needed. The content is drafted, vetted, and continuously updated by a team of pharmacists based on Canadian guidelines and best practices. The user can revise the content as desired. After the contents have been generated and revised to the user's satisfaction, preview and save to finalize the document. Lastly, the user can generate a care plan for the patient as well. Similar to creating a fax, the user adds the relevant alerts to bring up discussion summary and next steps. Revise the content as desired, preview, then save. Both faxes and letters can also be generated in French. To summarize, MedMonitor is built to help healthcare providers standardize medication management, but with the flexibility to customize the care plan for each patient. It is intuitive, user-friendly, and efficient. Thank you for watching. If you are as excited about MedMonitor as we are, be sure to reach out or visit our website to learn more.